Good afternoon, everyone. And hello, good morning, good afternoon, good evening to everyone online. It's for those of you online, you can imagine it's been a busy day and people are running around here and we're into our final afternoon sessions here, but it's great to be with you. So this is about monitoring wash systems, which hopefully has become the global paradigm here. And the issue that we wanted to present before you in this session is a couple of things, but one is some of the lessons that we can take from the health sector. I think we all hopefully are converging around what WASH systems mean. There's a number of building blocks and frameworks that I think all tend to mutually complement each other. They're quite similar. But I think if we are to succeed, and this is, I guess, the case that we'll argue and discuss also with our panelists, if we are to succeed with WASH system strengthening and a systems approach, we have to acknowledge there's complexities, there's all these various domains, and there's a long time frame. And I think at some point people are going to say, okay, are we making progress? It's not about counting toilets anymore. It's about understanding systems. And so all of us, I think, should be concerned about using different, terminology, different metrics, and not really being able to kind of understand whether we can kind of compare how we're doing on progress. So hopefully you think this is a good idea and want to contribute. The way the session is going to work is that we're going to hear a presentation next, but from Fiona and Sophia, and they're going to kind of give us a little bit of a background and an argument about how we can really draw some lessons learned from the health systems. But our objectives, just before I invite them to speak and we hear from a panel, is we really want to make sure that we all have a common understanding of WASH systems. This may sound basic, but when and I'm sure you've talked to many people, there's a lot of people that are very confident WASH system spokespeople, and there's other people that are scratching their heads a little bit saying, okay, what does this mean? So we're going to quickly review that from the perspective of GLASS as well. And we're going to review and discuss experience and insights, as I said, from the health sector. And then I think the most important thing is we're really hoping with this meeting and with your support to initiate a discussion and a process to define a core set of WASH systems indicators, which we understand will be no mean feat, but hopefully we'll agree is worth doing. And then finally, to put this in a framework. So I think with that, I'd like to, again, thank you for being with us and invite Sophia and Fiona to present.
Thank you, Bruce, and thanks everyone for being here. I know it's hard to keep the energy up with these long World Water Week days. So we're here basically to talk about WASH systems and what that means in terms of monitoring WASH systems. I think we know that there's not really yet a consistent approach. As Bruce mentioned, there's different frameworks and building blocks that we're all taking this approach to monitor and to consider what should be included in a WASH system. And at the same time, I think there's a lot we can learn from other sectors. I was in a session this morning on climate resilient sanitation, and it was really interesting to hear colleagues from the environment sector talk about these silos and the fact that yes, we at WHO are more the health sector, but we can't only be the spokesperson for health. You need to consult with other colleagues or a number of different health sector colleagues when you're trying to consider these various aspects. So I think the message is really to remember our brothers and sisters in education and health and environment, and remember to consult and just have that patience to consult with them. Sometimes you're not going to speak the same language. But just to set the framework, I think we're all aware, hopefully most of us in this room, that progress to reach the SDG targets, especially 6.1 and 6.2, on safely managed sanitation and drinking water and hygiene are not on track. We're about halfway through the SDG period at this time. And yet we see that some countries have made significant progress, right? we have these excellent examples of percent change from, for example, India and sanitation, and a lot of really interesting initiatives going on, and really countries setting those targets for themselves and, you know, using the SDG goals as their framework. So the question is, what factors really help countries accelerate to make increased access to WASH services? I think if we knew, we might not be here, but hopefully we can explore that together a little bit. So in the last glass cycle, we really wanted to answer that question, or start to explore it a little bit. Like, what are these acceleration factors? What areas do WASH systems have that really make a difference in terms of WASH service access? And to do that, we collected data, as we do every 2 to 3 years, on areas of finance, governance, monitoring, human resources for WASH. And what we came up with is that we have this report, of course. I hope many of you have looked at it. It was released in December last year, which summarizes the data from 121 countries. And we also have a data portal which shares all this information. You can look at country highlights and download these WASH systems indicators for the various countries that you're interested in. As a side note, we even had a few countries come in after the report deadline, so there's a few extra countries on the data portal if you're interested. And what we wanted to do was sort of start an exploratory analysis of what WASH systems indicators might make a difference in terms of countries being on track to reach national targets that they've set for themselves, as compared to countries that are off track and aren't even going to reach their own nationally set targets. We thankfully used some historical percent change information from the JMP, which was really helpful for this analysis. And in that way, we were able to categorize countries as either acceleration needed or on track. And what we found is a few interesting areas that I think can kind of set the framework for the conversation that the panel is going to have later in this session, and that Fiona will give us some insight from the health sector perspective. But essentially, one key finding was that when countries were reporting human resources sufficiency, overall, you know, you have this dark blue, or the darker bar is the countries that are on track. They're reporting more sufficient human resources as compared to the countries that were off track. We see similar findings when we look at regulatory key functions of regulatory authorities. So we asked countries to report how well these functions and key functions are working. And overall, the on-track countries were far more likely to say that these functions were being performed adequately as compared to countries that were needing more acceleration to reach their national targets. And then, of course, finance is essential. We need to be using and utilizing what we have. So we asked similar questions and looked at an analysis of how countries are utilizing domestic capital commitments, the funds that they have. And overall, we saw these differences again between on-track countries and off-track countries, and those distinctions in how much they're able to absorb. So these are some global findings on, you know, insufficient financial and human resources. So overall, countries don't have these resources. I think we're all aware. It's no news to any of us, unfortunately. But what we need to think about is that, you know, we started these exploratory analyses, but there's so much more that we could be doing. And there's so much more that we need to kind of consider and come up with some sort of common framework for thinking about monitoring WASH systems. Not only that, but there needs to be sort of a consensus about what we're talking about so that we're all making sense. And we have to just remember that we're not alone. There is, you know, health sector colleagues, there's climate colleagues, there's environment and education that can give us some insights to some of these things. And thankfully, we have Fiona Gore here, who's going to give us a little bit of insight about what we can learn from the health sector in order to make stronger indicators and learn even about the process, what we need to do in order to collect this data and have it used to track how we're doing. And I'll hand off to Fiona Gore. Thank you very much.
Thank you, Sophia. Great, thank you. So I'm going to take you on a little journey, but I have a pretty big gap that I needed to fill before this session. And I know I have a tendency to walk around and move, but I'll try not to, because I know I'm not supposed to go too far from the microphone. First of all, just before I start, I just want to say, as you will see, we have an all-female presentation. So I think we get a gold star for that, right? Well, probably because our panel is majority of men, so I just wanted to make a note of that. But quality men, let me tell you that. So, great. So moving on, let me take you a little bit on a bit of a journey. And I'll maybe come back to the session we were just in a couple of hours ago, and one of our panelists, who's in the room right now, said, yeah, we all use different terminology. Foundations, I've heard buckets, building blocks. And so there's a lot of terminology out there. The idea today for us to come here and to sort of have a discussion about this, quite honestly. And this is what we want to do with our panelists. And I think we talk about WASH system strengthening, the strength of the system, a systems approach. What do we all mean? Do we all have the same definition of that? No. We all have a different interpretation. And I think it's a bit of a buzzword. And looking at the program for Stockholm Water Week, there's a lot of sessions that talk about WASH system strengthening, system strengthening. So I think the idea with the panel is really to sort of come round and see, do we all mean the same things? And I see people saying no in the audience right now. So the idea is really to come back to that. Basically, the way we work now isn't working. And I think I don't need to convince you all, this is why we're still here. So we need to do things differently. And just here, I'd like to quote the WHO UNICEF Interactive Dialogue concept paper that was launched in New York in March. And here again, we've got different terminology, but it's the transformation, the foundations, and to work differently and to have a different approach. And again, here we talk about strengthening national systems. But what do we mean by that? What do we mean by national systems? So the key question of us being here today, and of you coming, and thank you again for all being here, is, the question is, do we have a monitoring strategy for WASH system strengthening? And I think that's what we want to try and establish. And there's been a huge amount of work going on over the last few years by a number of key partners in the sector. And I mean, just to name a few, I mean, IRC has done tremendous amounts of work of research around WASH systems. UNICEF, there's the SWA building blocks, there's the UN water accelerators, and we refer to system elements in the GLASS survey. And it's all a bit of a variation on a theme, because we can all relate to the different elements, as Bruce was saying in the introduction, of these different frameworks, these buckets, these bins, or these building blocks, whatever we want to call them. Agenda for Change has also been instrumental, including WaterAid, IRC, Agua Consult, and a number of actors have put a lot of effort into this. But are we all speaking the same language? And just here, this is another framework that also from WaterAid, which all these frameworks make sense. But just before this session, I was talking with our colleague from WaterAid. We all work with the same actors at country level. And we're all coming with different buckets, different frameworks, different building blocks. how are they going to understand that if we don't speak the same language, the same terminology, and use the same concepts? So let me take you on a little bit of a health journey. When I was really, really young, I used to work in health system strengthening. And let me take you back to the late 90s. Now, I'll reassure you, in the late 90s, I was really, really young. But I was nearly at WHO. But Chris Murray, absolutely everybody knows Chris Murray. Julio Frank, both at WHO in the late 90s. And in the year 2000, the World Health Report came out. It was, if you allow me to say this, revolutionary. They were actually examining and looking at health system performance in the year 2000. It caused a lot of controversy, but I think it was revolutionary, as well as the World Health Report in 2002 that was on data and evidence, and where there was the development of, the importance of using data for policy dialogue and for decision making. And this is, we're talking about DALYs, we're talking about burden of disease, about mortality. And these World Health Reports were absolutely instrumental in getting the thinking started. And then the journey continues. And in 2004, the World Bank and WHO started thinking, okay, health system performance, how are we going to measure that? So the World Bank and WHO were instrumental in developing indicators, a monitoring strategy, concepts that went along with it. And then there was a global framework for action, which was called Everybody's Business back in 2007, that reiterated the importance of health system strengthening. And with all this, within this whole arena, we had IHP Plus, International Health Partnerships, and the Paris Declaration. And we then developed a document, and I was part of the development of this third document on the right in 2011, where we thought, okay, we now need to agree on a common framework, on a monitoring strategy, and on indicators. So that's what we did. And this is what we ended up with. And this is, I'm not going to spend too much time going through the details, but the important bits here is really to say that we also had, at the time, back in 2009-10, when we were developing this, different buckets, which made sense at the time, and really taking us through the monitoring results framework. And there was a broad consultation on actually developing some key indicators that would measure each element of these building blocks. So there was then definition of these indicators. There was a development of the metrics behind these indicators, defining data sources, analytical methods, and then how to synthesize this information across the chain and actually produce snapshots for country use, for better decision making, for better investments, et cetera, et cetera. And most of all, data use, to be used in joint sector reviews and other national processes. In this document that we produced and published in 2011, we defined a core set of suggested indicators for the various building blocks. So it was all great. So how has it all been working out? Well, then I left. Where did I go? I went to join Bruce and the team to lead the glasswork. So I brought some of these elements with me, and I like to think I brought some of these elements with me, but maybe not very strongly. But now's the opportunity to share some of this work. And all that to say that I thought, when we were trying to design this session, we thought there's probably a lot of lessons learned from the health sector. And I was speaking to Patrick, and we thought, okay, we can bring some of these lessons learned, what worked, what didn't. And I thought, well, I've got a gap. I may still be young, but I really have a big memory gap of nearly, more than 10 years. Well, 10 years, in fact, of what happened in the health sector. And in fact, you know what? A lot has happened. And I got in touch with our colleagues in the division that deals with universal health coverage. They put me in touch with the primary healthcare measurement committee, and they have been extremely helpful in the last few days in trying to fill me in of what the evolution has been. Well, let me say one thing. It hasn't been easy. It's been really complex, and it hasn't been a straight road. So just to say that UHC was, in fact, the transition and evolution from IHP Plus, and then PHC measurement was what was monitoring UHC, basically IHP, what was IHP Plus. It's been a rocky road for the health sector. And I think we have a lot we can learn from them. And I think we can. Now, they also shared some slides, because I said, so what's been happening in the last 10 years? So they shared a slide with me, and they said there's been a lot going on. And there was a lot of endorsement for the 2011 document that we'd produced. Assessments here, various documents, templates, for decision makers, pathways to health system performance assessment. And there was a lot out there. So they, last year, published a document to try and bring all this information back together. Because although, the health sector is definitely there are a lot of actors, as you all know, in the health sector. And a lot was developed. And so the idea was to bring all this material together and develop a conceptual framework that links health system functions to intermediate and final systems goal. Now, let me move into some of the lessons that they've shared with us on what worked and what didn't. And I'm actually going to concentrate on what didn't, because I think that's more helpful than praising. They did a lot of great stuff, and there's a lot of great stuff going on in the health sector for health system strengthening. But there was a few things that they shared with me over this period of the last 15 years where some aspects didn't work so well. And one of them, I think, is really critical here for us to learn from and for our discussions, is that only fragmented efforts were made to improve data on the health system building blocks. And I use the word building blocks on purpose here, and the monitoring aspects. And one of the things they were saying to me is that those original building blocks that were developed, the conceptual framework, were very static and producing these snapshot assessments. And that they said little about performance or the actual strength of the system. And that there was really a focus, back 10 years ago in the health sector, on the actual structural elements. And there was very little reflection on how inputs relate to output and outcomes. And this is actually something that came up in a session we were in yesterday. And that there was a lack of interconnectedness between the various building blocks, the different buckets that we're dealing with. And that's probably the biggest lesson from the health sector. They also developed country dashboards to try and simplify this and to make sure that these could be used at country level. But it turned out to be a little bit more difficult than they had anticipated because of poor availability and quality of health system data. And this is going back over 10 years ago. There was also at the time some substantial investments in population-based health surveys to improve the availability and quality of health statistics. But again, this was being focused on the right-hand side, on the outcomes and impact of the results framework. So overall, the main barrier toward better monitoring of health systems was basically down to, two of the main barriers was the failure to invest in standardized and sustainable measurement strategies for generating and analyzing health systems data, and also to build institutional and individual capacities for collection, analysis, sharing, and use of data. And I really want to focus on the use of data. Sorry, one second. So here's how the framework evolved in health. And this is what is the most recent framework, health system strengthening framework, from the Primary Healthcare Monitoring Group. Now, what they've developed to go along with this is a menu of indicators for country selection, adaptation, and use. We're not going into this into detail, but what I'd like to say, and I think this is also a critical point for us to get into discussions, is this is really giving you, in a few minutes, the evolution of thinking on health system performance. And so really going from building blocks, a static building block, to more interconnected health system functions. And I think they've insisted quite a lot in my interactions with them, and notably just on Friday afternoon, they say, don't forget to talk about health system functions, which I think is also critical. But also their outcomes across the theory of change. I'm also going to show you their dashboards. Dashboard, country snapshots, scorecard, whatever you want to call them. Again, we have a lot of terminology on this. And these are an example for individual countries, and really trying to highlight where a system is strong and where there are challenges, and trying to identify bottlenecks. So moving on, now trying to relate it back to us in the WASH sector. So what can we learn? So health system strengthening is basically based on a more revised common conceptual and connected monitoring and review framework for the National Health Plan. On an agreed core set of indicators across the results chain, linked to the PHC monitoring framework that I've just shared with you, which are responsive to national policy priorities. And I think this will resonate with many of you, on country compacts laying out how government and partners will work together on a national health plan to facilitate implementation. So that's what the health sector has in place. Now, what elements do we have, and how can we relate this back? So we have, as you heard from Sophia, we collect information through the GLASS survey in more than 120 countries around the world every 2 to 3 years. We have data on inputs and processes. We have over 300 indicators in the GLASS report. Pretty overwhelming. There's work going on by OECD on the scorecard, investment enabling environment for investments scorecards. There's the work by the bank on credit worthiness. And I'm probably missing out other work that's happening, but it's just to give you an idea that there's a lot going on. But we don't yet have a core set of indicators agreed upon, and that we can then help support countries to collect and integrate into information systems. We have a number of WASH system frameworks, various buckets, UNICEF, IRC, WaterAid, but we have yet to develop and agree on a common monitoring and review framework. And lastly, SWA, and the work by SWA is absolutely critical on, the WASH compacts. I think there was also a meeting yesterday. There's the work on the SDG 6 Integrated Monitoring Initiative, the Country Engagement Working Group. And so we need WASH sector-wide agreement on a mechanism to support national priorities. And actually, another thing that my colleagues at PHC at WHO shared with me last week, they said process matters. And it does. As much as many of us, process, let's deal with the data, let's analyze the data. Process does matter. It's about getting consensus, it's about discussing, it's about agreeing. So this is my last slide, because I'm really, really excited about us having an engaged conversation about this. So if we are able to develop a sound monitoring strategy with a core set of indicators, allowing decision makers to accurately monitor progress evaluate impact, and evaluate, we're not very good at evaluating, we need to do evaluations more, and ensure accountability. And I think there's a few principles, considerations we need to consider in these discussions and in this nearly all-male panel that we're going to have, is a common framework with conceptual linkages and the interconnectedness. Because I can see some of the work we have done has been siloed in some of the assessments we do and lacking the speaking to each other between the buckets. The multi-stakeholder consultation aspect and the process and the sector-wide approach is critical. And I think I'm preaching to the converted here. It is critical. And actually centering countries, putting countries at the center of this, as was the case and is still the case with IHP+, but with also the UHC 2030 agenda, will also allow, not only of taking their priorities into context, but also allowing for global comparison and global monitoring. And I think that I've mentioned this, but I want to mention it again. The idea is to be able for us to step back and to capacitate countries, integrate these indicators into information systems to allow collection, analysis, and interpretation and communication of some of these results. So with that, I'll finish off with my final word about strong, resilient WASH systems are important. They're critical. But how do we know if they are, if we're not monitoring them? So with that, I'm going to pass over to Bruce. Thank you very much for your attention. And Bruce, back over to you.
Thank you. Thanks, Fiona. Well, I will know a strong WASH system when I see one. So the next, I think I heard some reactions being elicited from the room, especially with some of the maybe warning signs that I think we're seeing from the health sector, health systems monitoring. And I'd really like to kind of dig into this, because I think what we're at a point now where, I think really if we step back, what we're kind of proposing is, should we be bold and do this? But if we do, should we be careful about how we take the leap of faith so that things can be as right as possible, so we can avoid some of the potential pitfalls that await. So we have some very smart people that will be moderated by an all-male moderator. That's me, so I apologize. I'm feeling very guilty for my gender these days. Anyway, but here we go. So this is the panel, and I think what I unfortunately will be asking you to do is to come up and be standing the whole time, so that always keeps people spontaneous and slightly uncomfortable. And forgive my very quick introductions, but you all hold very important positions in your organization. But I'll just invite first Patrick Moriarty, the CEO of IRC. So Patrick, it's great to have your insights, and come on up. Yeah, please do whatever. I am not a prescriptive moderator. Tripti Rai, who is the country director of WaterAid in Nepal. Where are you, Tripti? Wonderful. And Kevin Russell, regional coordinator for Africa for Sanitation and Water for All. Kevin, I'm sure you'll be able to inject some sense into this. Good. Now we have Aidan Cronin, senior advisor at WASH for UNICEF. And of course, Joel Kolker, global lead for water and finance at the World Bank. So hopefully there's space. I think what I'm going to do is this microphone working? You can have. Is this on? Okay, I'll just keep testing 1, 2, 3. Otherwise, I'm happily going to use this one. Okay, no, it works. Okay, so I think, my first question, I think, to all of you is pretty open-ended. You've seen the presentation. It elicited, like I said, some reactions. So what is your kind of first or few reactions to this? So I think I'm just going to leave it like that. Should we be doing this? But, there's... Yeah, so I won't over-engineer this, and maybe we'll just go in order since it's easier. Or No, it's okay, Joel, honestly. No. Patrick's, you're good at this. This guy's a seasoned professional. So Joel, over to you.
So I guess I had two very quick reactions. One was actually it was almost texting Bruce. I was wondering, what does the energy guys do? Yeah. Because I mean, it's more than infrastructure, but it is a form of infrastructure. So that's just a question for you all. And then the other is when you put up creditworthiness, it resonated, and I did think, an indicator that is accepted in the financial world is your credit rating, whether you're a utility, a company, or an individual. But as we've learned from the financial sector, your credit rating is backward looking, and it doesn't have any indication on what your future risk is going to be. So we can spend a lot of time looking back, which is the data, and it's important, and obviously figuring out what to do is quite important, but we have to recognize what are we going to do with that, and this goes to the point, and I'll fess up, Fiona, I was the guy who mentioned the bit about language, and I just want to explain a little bit more about what I meant. I'm not sure who all is in the room, but we refer to people that we work with at the country level, subnational level, in a water utility or an irrigation agency or a dam safety group as the client. And at the end of the day, for us, that's the only group that matters. All this data that we collect, and whether you're in academia or an NGO or an institution or a bank, it's nice to have, it's important, it justifies money, it could set out your program, but at the end of the day, it's ultimately the client that we need to talk to. And the point that I was trying to make about language is when we go and talk to those people, and hopefully we are talking to them a lot, if you go in and talk about foundational issues and the next guy through the door comes in and is talking about enabling and the next person is talking about systems change, it gets very confusing. And this is why I think language is, in fact, quite important, and we have to figure out what best to do. So those are my initial observations.
Great, thank you. And so first answer is yes. Okay. Yes, I think this is a good idea. Yes, I think we should do it. Why? Because I think that, and we had this discussion preparing for this, Fiona, you were saying, oh, it's an awful mess and let's sort it out. I'm more of a glass half full perspective. I think that over the last 15 years, and particularly, let me say, I'm talking about what I often call the WASH community, which I don't necessarily often include Joel and folks in, because I say the WASH community is the NGOs, the WASH community is the charity, the WASH community is that deeply, deeply neo-colonial concept of appropriate development and community management. Okay, so hey, we want water coming out of a tap, but you guys go sort yourselves out a hand pump, right? So the WASH community has come a long way in the last 10 years. We've introduced the idea of service levels. And so you're putting service up there. We weren't talking about service 15 years ago. We were talking about hand pumps, bits of technology. And now we've begun to talk about systems. And I often talk about getting rid of the systems blindness, right? So I think the fact that everyone's talking about systems, whether they call it enabling environment, whether it's foundational elements, that's a huge step forward. And it's a mark of our success that people are now beginning to ask your question, how do we know if the system's getting stronger? And I think that's why those of us who've been involved in developing all this kind of letting these 1,000 flowers of different ways of measuring, experimenting with different ways of system strengthening, whether it's WaterAid, Agenda for Change, UNICEF, all of us, I think it behooves us to begin to come together now and to lead what's going to be a long and difficult process to actually thrash out what, something that looks like where the health sector's gone. And we were certainly inspired by the work of the health sector when we began working on the Agenda for Change building blocks sort of 10 years ago. We looked at that document of yours, so it's really that you put up. So it's really interesting to see where health has gone on this, because what really struck us about it was that people funding the health system are prepared to pay for system strengthening in a way that it's been a real struggle to get them to pay for in WASH, because they want to go and pay for some infrastructure. And you go, but hey, there's no regulator. Right. oh, okay, but no, we shouldn't pay for that. That's government's business. We'll lend the money to do the infrastructure. So for me, we're on a journey. We're making great progress, and this is a logical next step.
Thank you. So the first question, I think it's a very thoughtful presentation. I just want to begin with a reflection that sometimes as development organizations, or whatever we want to call it, are we really finding the solutions, or are we part of the problem? So I started to think, maybe sometimes we create the problems. In terms of the context of Nepal, definitely I feel that because we have so many actors working to support the same stakeholders, we often see confusions around what are the priorities, what are the kinds of capacities that we are supporting, a duplication of resources, often not able to then see what the end result is. Because very important as water aid, also as an organization and a person working for people to get safe drinking water, decent toilets, and good hygiene, does all of this then really help people get those services for the long term? So having a strong system, whatever that system is definitely essential. As organizations responsible and accountable for the communities that we serve and want to work for, it is equally important that we make sense in terms of how we are working together. So having some common systems in place, some common indicators sounds like a good way forward. However, how do we get it done? I think that's something we really have to think of. Learning about the experiences in countries, what already exists, not just in our organizations, but at those local levels, subnational levels, national governments. Like in Nepal, we have 3 tiers of government. So in each tier, we see different kinds of complexity. So we're not just talking about one national, one, whole thing. We're talking about 3 different sets of governments working for wash services to serve the communities. So I feel that's a good way forward. However, I would be very happy to see how we can have a wider conversation, get more thoughts in place. And looking at Nepal currently, I feel we already have some systems that we are working on. For example, something called the NWASH, which is a national GIS-based data system. We could work on how we can help support that system. So lots of thoughts there. And just going on the conversation around standing out, I think sometimes we should not be afraid to stand out. And here I thought I needed a fancy jacket, but what can you say?
Thanks, Tripti. Maybe just a couple of reactions from the PowerPoint. First of all, I think it was excellent, Fiona. You really distill a lot of information, very succinctly in a short period of time, and you showed us in a way why some of the drawbacks in the health system strengthening approach. You mentioned capacity and standardized approaches, but if we flip it a bit, we also know what has worked, and that we all kind of went ooh when you showed the country dashboard, that one slide with lots of different colors on it, and we immediately reacted on that, so that we were awake. But I think what it shows is that like a small number of high quality data points can really make a difference. So that's a takeaway that I took from that. And we know it's not rocket science. We know some of those elements. We know it's capacity. We know, yes, money. It's an ugly word, but we have to put it in there. We have to also bring in the equity side of this. That was there, so that was nice. But we also know that there isn't a huge amount of money out there for new systems of collecting data. And so recently, actually, there's been a drop in funding for collecting gender indicators over the last number of years. And WHO and UNICEF have seen this with the recent JMP report as well, how difficult that was to really have solid gender analysis of the sector. But so we're going to have to keep using the existing sources of information that we have, household surveys, administrative data, maybe new ways of working through social media outreach. We're going to have to think outside the box a little bit. But I also wanted to come back on this point of people, and you mentioned it, Patrick, in kind of service level, and Joel also mentioned your credit versus risk. Your credit is looking back, your risk is looking forward. We're looking forward in a in an experiment where we've been pumping CO2 into the atmosphere without knowing what the hell is going to happen. And we know we're not going to control the current level of temperature rise without serious and drastic action. So why I'm saying this is that resilience systems are made up a lot of different things. So people, infrastructure, systems itself is an indicator of resilience. But ultimately we're focusing on on people here, on the equity angle through WASH. And I want to say this also from the perspective that we had yesterday a very nice session on from the Sanitation Learning Hub about participatory approaches in WASH. But are we bringing in elements like this into our systems, or are we just looking at that usual diagram of a cog moving? And so we've a lot. I think we know what's there, but we need to do another twist of the handle to come up with actually the language and the process that we all agree on. And we've also been cracking our heads together on this with fantastic partners like RRC, like SIWI, and it's not easy. It's not easy to come up with the number that, or the way forward. So we still need to do another turn of the wheel on all of this. Thank you.
Perfect. When I stood at the end of the table, I didn't want to get picked on first, but now I've got nothing to add to. So let's start off with all of the above. And I'm going to look at this maybe slightly differently, Bruce, at the question of the kind of the politics of this and how we bring people on board to understand this. When I saw the slide with the first health report, of course, it took me down memory lane. And one of the things that was different then in 2000 is when a report of that nature came out, it was automatically credible. People read it. Nobody said this is fake news. You read it from the front page, not the back page, to see who funded it, to figure out why it might go in a different direction. And so with all data, there's contestation. Why are you reaching these findings? What is influencing this discussion? And increasingly, looking at 2000, we were at a time when the internet was around. We were looking at information. We had access to constant information. That when a report came out, it almost reinforced things you'd already started thinking. It didn't divide, it unified, and it gave authority. And I think, as these systems go, it's really nice to see that they are complex. And simultaneously, every time you learn something new, you discover something, you can't undiscover things you didn't know, which means you're perpetually going to have too much data and too little data. And I think this is very important in trying to bring people on board. How does one communicate? How do you create almost a democratic function around data to ensure that people have access to information, that when data comes out, it is credible? I just want to pick up one thing, maybe, Fiona, from the end of your slide. You mentioned SWA WASH compacts, and it directly mentions my organization, but they're not SWA WASH compacts. They're heads of states initiatives. And working in the multilateral system, member states are very important. And we're very fortunate to have the government of the Netherlands supporting a drive with us to reach countries. They've now been joined by 10 other countries that are developing presidential compacts. And I'm delighted to be on stage here with Patrick and Aidan, who are partners in this process. And when we started this, we thought, the problem is this fragmentation in the WASH sector. In fact, I think at the UN water meeting, we're not even calling ourselves a sector anymore, we're calling ourselves a community, because we're not strong enough to be a sector. So the WASH community. And essentially the problem is that if you go into a national system, there's no dedicated ministry for sanitation and water. Well, there is now in a couple of countries, which is great. But even then, it doesn't stop education from having a sanitation function or water function, health ministries, a whole range of other people. So you do need a coordination point. You need some apex point in a country. And for us, that apex point was one person, the presidents. There could only be one point where you could bring all these fragmented players together. And I'm also delighted, I think, in the UN system, moves are being made in the right direction towards a system-wide strategy. Now, those things will help us. But I almost have to pose a question to our colleagues at the WHO. Don't we have an SDG with a set of indicators? Do we not have a common set of goals? I think it happened around this time with the MDGs as well. You got to the midpoint and things evolved so much that you almost need to recreate the unity you had at the beginning of the goals somewhere in the midpoint to focus everyone for the next 7 years. But thanks for the question.
Maybe I can answer your question, because anyway, first of all, thanks for that first round, and I think it was interesting that I mean, I'm hearing a lot of sort of, I don't know, guiding principles, right? Things that we need to think about as we take this forward. And I actually didn't follow instructions, but because the question sort of was like, should we do this? Yes or no? Why not? And in a way, I didn't really want to ask it. But I do feel, and I'd like to also hear from the audience if anyone feels like we shouldn't do this. But my sense of this, Kevin, just from a sort of WHO perspective in terms of what we've produced, we have a GLASS report. And there's a lot of indicators in there, and in a way, it's sort of fairly analogous to we had that it was purporting to talk about systems, right? It's enabling environment stuff, and so when you look at that document, we should be able to hopefully get a sense, of where we're going on systems. And so I think part of this discussion is broad, and then part of it is also kind of specific to that. And when we talk about SDG 6A. Or 6B, means of implementation, and all these other things, it kind of gets a little bit back to systems. So, but can I ask the audience, do people think is there anyone that doesn't think this is a good idea, that think this is just going to be confusing, or is this, you have a comment there? You want to share that? Okay. Sorry, I'm used to running. It's very hard.
Yes, thank you. My name is Irene Guy from Veltunga Hilfer. I have a slightly different opinion on that. And this is coming from the perspective that we are just 7 years to the commitment we made as a sector to deliver services to the people. One perspective, I'm a bit concerned that 7 years down the line, we are thinking of recreating tools, yet there's already so much out there. And I want to start from the perspective that in my understanding, systems are meant to operationalize rights. And we already have a very clear, definitive framework around monitoring the rights to water and sanitation, which essentially system strengthening is meant to deliver on that commitment. So why should we look for a different set of indicators, yet there are already clear indicators that essentially explicitly demonstrates how we can deliver rights at the end of the day, because that's the very objective. So I was looking at a different way how we can complementary address the conversion if there are elements around the framework that doesn't address, say if financing is not quite articulative in terms of the progressive realization to say we want to see this traction annually in government budgets. That is the kind of conversation we need to have, but not entirely thinking of, again, a separate framework. That's my own take.
I think a tremendous comment there about concern about creating another additional monitoring layer, and I think we definitely can address that. Comment in the back.
Was it you?
Hi, my name is George de Gooijer. I've been involved in an activity that was done by UNICEF based on a new tool. Am I echoing? That was developed, among other things, by SIWI, the System-Wide Sustainability Check. That is a very nice attempt to start looking at the whole system. It's an attempt because it's not explicit when it comes to the theory of change that's underlying, so it's still to be improved in that respect, and it's not perfect at all because of the way it's being implemented at the moment, which is on a shoestring, and without really sort of investing in properly doing the study, because it could be really a good tool for at least having a sort of a zero measurement of what the situation is. I've been involved myself working for the Dutch government at country level at the embassy in Niger, and before that in Benin. And the problem was always to know whether what was happening was also really happening. What was happening according to the reports was also happening in terms of services. And the nice thing of this system-wide sustainability check is that it is a triangulation of both the service level at household level and what is in the report, and then sort of trying to understand, so what is it that's not going well here? So in that sense, it is a tool, and I think something like that as an intervention, not as sort of a permanent system, but as an intervention, is extremely helpful to justify the funding that you're requiring and where you should be investing, both for government and for partners. So you need that kind of audit to have information. Self-reporting mechanisms, like GLASS is a self-reporting mechanism, are easily sort of very incomplete or sort of very not balanced in their quality. So having that tool, and that's an experience that could be also part of this conversation.
Go ahead.
Thanks. It's on. Important conversation and a good checkpoint as you'd mentioned. I'd like to hook into something that Joel had said in terms of, at the end of the day, it's our client. And what I'm puzzling about and want to share is that in 2022 alone, we had 50,000 people from almost every country in the world access our services online, the training and consulting support. 200 to 600 people are registering for our courses online, and from 20 countries per course. And we've got a pipeline of about 238 organizations who previously we wouldn't have seen who want to be training other organizations. And when I go back to looking at how we can improve the monitoring and the providing that direction is how can it help simplify versus add to the complexity? I really like that we're looking at what you're doing in terms of looking over the fence or hooking in with other of our colleagues in the health sector, and I love the idea of looking at the energy sector. What do we know from the corporate sector at large, so to speak, in terms of what drives people towards a common goal, and and how would we as an organization translate the a model like that for thousands of people around the world who are taking action on the front line to improve the water and health in their communities. So I'm left with more questions than answers. But at the end of the day, it's who's our client and how do we make this as easy as possible for them.
Thanks, Shauna. I'm gonna we'll maybe come back to the audience if we have some time. And I think it's before going back to the panel, it's worth I think clarifying this a little bit. And before I try to just make a few responses myself, I think just given what we've heard, maybe we'll go to the last question, which was about the countries and how this can be useful to countries, and then maybe we can talk about sort of practical next steps, because I think that's what people are concerned about. So first of all, this is not project level monitoring, and I think the idea is really, I think we've heard a number of times here that it's about existing data sets, existing sources of information. It's about trying to limit the scope of a large number of potentially applicable indicators. And I think most importantly, and Fiona mentioned this very clearly, which I thought was very interesting. Okay, what was the big pitfall that we saw? It was people didn't agree and align. So Shauna, you're saying like, how can this be useful for, I don't know, the world? And it's not going to be useful if we aren't aligning on the indicators all the way up. And so for me, it's my personal take on a lot of this stuff is it's maybe less about the perfect indicator and more about whether there's agreement to use it and consensus. So that's why we're here together, to think about this process together. And there's not necessarily an ownership issue here. We need to just honestly work in good faith to try to find. So anyway, I was hoping everyone would raise their hands, so this is a great idea, and the roof would come down, but we were all too thoughtful for that. So that's, yeah, but it's good. It's a good start. We'll start cautiously, and we'll do our due diligence, right? So are we okay if we do the same thing over again? And maybe the question is, many of these discussions are happening at the global level, like they are right now, like you mentioned, Kevin, but how can we make sure they're useful to countries? That's what I think you were sort of saying back to us. So let's deal with that, and then we'll talk about next steps. Or do you want to go last?
Yeah, go ahead.
Okay. Then we can agree.
All right, Joel, you're going to end up with all of the above now. Yeah, I think I probably set myself up for all my answers now. In light of the credibility deficit I'm talking about, I think at a country level, so even though people at a global level might disagree with data sets and have, this kind of, lack of unity on that, one of the things about data is ultimately it is political. And I'm not going to mention specific countries, but it's political to the extent that even monitoring and information systems are live streamed into ministers' offices, right? And they see a snapshot of where they are. And if they don't have it live streamed into their office, they're going to get a tweet or an X, as it's called now. But somewhere they're going to get some communication about how well or not well they're doing. And I think, again, like if they present data, it's often going to be challenged. But when you have a global unified set, it provides a nice check and balance. I think that's an immediate thing. It forms some form of mutual accountability is a word we like, but it forms a bit of a global peer review. It presents an opportunity for countries to compare each other. I think the value of this is really super clear. And I think if anyone's involved in activism, it also gives people a benchmark on what it is that you need to be advocating for. And advocacy within government, we do a lot of work with government advocating amongst themselves to move certain things in terms of prioritization, but also advocacy from outside. So I think from a country level, the utility of this has always been good. And the credibility there is probably something less challenged than it is in the multilateral space. Thanks.
Thanks. I'll give a super practical example. We've just gone through this ourselves in UNICEF. We wanted to capture our work that was contributing to systems change in sectors. We eventually came down on 5 indicators. 1 was around having a financing strategy for a sector. 2 was around actually leveraging additional financing. So that's a specific indicator is more fine. It doesn't matter where that's coming from or to who. 3 was around coming to your point on the sector-wide sustainability check, that our monitoring national monitoring systems, including that, because as we know, if it isn't sustainable, then we're just going around in circle basically. So, and that's not, it's a core component of any system, definitely is sustainability. So I think that was an important interjection to remind us on that. 4th, around climate. Are we linking the climate resilient WASH story into NAPs, NDCs, climate rationales? So that's absolutely critical for any discussion on systems moving forward. And the last one was just around the power of the work that we do collectively to de-escalate conflict and bringing the humanitarian development space closer together, but potentially with a lens of insecurity in there, which the WASH sector hasn't really been doing enough probably on, and in the current fragility that we're seeing from so many different reasons, that's really important movement. So that's we put our heads together. We came up with that. It's not perfect. It's not anywhere close to perfect, but it's what we came down on as a first step, and it's of course. There's been lessons learned, and we've a lot of learning still to do, but I thought I would just share that. Thank you.
Thank you. So for countries, I feel maybe the same conversation may not be happening in the same way, but I feel that there are various conversations that often are talking about how do we make services sustainable, how can we make communities resilient. So I feel that there are different ways of having these dialogues, very relevant in terms of how countries then work towards the sustainable development commitments that they have. In countries where we work in WaterAid, I feel that we are all talking about how do we ensure communities have a voice in making these systems accountable? How do we ensure that the capacity of governments and service providers are there to ensure that these services keep running and are affordable, are equitable, are in the reach of even marginalized communities, most important. So I feel that these are conversations we can have. Currently, I feel one of the processes that helps people come together, at least as a sector or a community, are these sector reviews or annual reviews that we have in the WASH sector. It may not always happen very well, so I feel organizations like us can really ask for, promote as well as demand that these conversations happen for accountability of institutions. So these are quite important. In terms of the building blocks or buckets, now I'm also confused, whatever we call it, I feel it's very essential for us to agree on some common minimum components, because I don't think we will be able to make something that everybody is happy with. And I'm sure at a very local level, there will be different components that add value, because at that local level, that system needs that to be measured. However, what are those common principles and standards that help us as a community to see how we can make progress? So yeah, those are some of the thoughts I have at present.
So, yeah, I think we're talking about benchmarking. And I think benchmarking is something that, at least, in the private sector, everybody understands. Why do you do benchmarking? You do benchmarking to allow comparison, right? We do it in the sector. I mean, we do it in the utility sector. Everybody knows what non-revenue water is. It becomes a benchmark. It's an easy indication of system strength to some extent. What is your non-revenue water, okay? And international benchmarking, and I think that was the point you were making, Kevin, hugely important. I mean, the PISA tests for internationally benchmarking educational achievements, Transparency International, international benchmark for corruption, ease of doing business, right? So, and I don't think this is taken away. I completely heard your point. Remember, we do have an international benchmark for achievement of SDG 6.1 and 6.2, and we've got several people from the JMP sitting here. This is not taken away from that work. And, I've seen in country the sort of discussions you can get around that international benchmark, and it's hugely useful to civil society, because that's where, the ministry's saying everything's hunky-dory. And then Tom and Rick can all bring out their report, and it's like, oops, well, it's not quite as hunky-dory as that. Civil society grabs that and uses that. And I think, from what I understand we're proposing is that after 10 years of pushing the concept of system strengthening, we're saying, hey, let's see if we can come together with all of our buckets and building blocks and all the rest and agree a set of key performance indicators so that we 3, 4, 5 that we can actually go and say, yeah, well, part of the reason that you're doing so badly on your JMP indicators is that upstream you still haven't set up that regulator. You still, so that's my take on it, and I think that's why I'm excited about it. And last, I do think this is what I said to you, Bruce and Fiona. I mean, we're not going to do it today. I think what I'm agreeing to, committing to, is to be part of a process to lead this forward, and that means bringing the voices from the country, voices from everywhere, and this isn't something to be cooked up in a back room in UNHQ or wherever it is. This is about bringing together people who are working in the field, who are thinking hard about how we're doing systems, what we're learning about systems, and what is that key set of 5 or 10 things that we all have to agree need to be in place if we're going to see progress on our key outcome indicator of access to services.
I just add, while it's benchmarking, I think the real value in this is what we do with this, right? You've got a number. I went back and asked Bruce for the question because I wanted to make sure I addressed it are these discussions happening at the global level, but how can we make sure they're useful to the countries? Well, I can tell you from my own personal experience of living out there and putting projects together and going through the review and the assessment, that key policy is made based on these numbers, and perhaps as important, key financial decisions, public policy decisions, public finance decisions in the hundreds of millions of dollars are being made in this. Whether you do water or sanitation, whether you do rural or urban, the geographic context, the income level you deal with. These are all factors that we use when we're putting together our efforts and our policy dialogue and our projects and our investments. And, in our particular case, many of these are loans, so it's not a grant, and the rigor that we have to go through looks very carefully at these numbers. So if there's any question at all whether this is of value in terms of the numbers, key policy decisions are being made on this, and bad policy decisions are being made if we don't have the right information. And likewise, the financing being put in place is very much dependent on these factors. So we have to get it right. So I hope you feel the pressure.
Thanks, Joel. Sorry, Fiona has a question or a comment.
I actually just want to compliment the panel here and to say on Friday, I asked our colleagues in the UHC 2030, I said, how do countries react to this concept of health system strengthening? Do they understand? Are they on board? And their answer was, since the COVID pandemic, they really believe in system strengthening, and they understand why, more so than ever, why we should be focusing on systems.
Thanks for that. And I see we have also elicited more reaction from the audience, so please go ahead. We're keen to hear what you have to say.
Hi everyone, my name's Zoe. I'm a junior rapporteur, but I actually work in sustainability at Expo City, the host of COP28. I feel like this session has made me more confused, but even more curious about the WASH sector. But we talk about systems change, we talk about different layers of government, we talk about all these different moving factors. I think that I would like to hear key takes about how we actually build capacity and how we do that. Everyone is much older than me on this panel, but how can these experts teach me to bring these systems change as a WASH practitioner, as a sustainability practitioner, not just at a government level, but at building capacity across different young professionals? Because I think if we're moving towards the next 15 years or the next 5 years, we really need to upskill the people that are already in these sectors and that are already implementing change at various different levels, whether that be local, regional, or global. So just wanted to hear some thoughts about current upskilling.
I was going to say maybe it was a message to not respond. No, but I think one of the things that would be, I think, interesting for the panel is to dig into your question a little bit, because if we go back and we start looking at some of these systems, and sorry that we have confused potentially, some of you in the room and sometimes maybe ourselves, but I mean, if we, it's all seemed to have disappeared here. But I mean, if you look at governance, if you look at monitoring, if you look at financing, if you look at human resources, each of those domains, there's an incredible array of expertise and training and everything else required. And so I think part of our discussion is about trying to understand that there's this connectivity. I mean, these are the experts between these things, and we shouldn't be dealing with issues in isolation. So we're trying to capture that. It's kind of like a physician. Our health systems, many of them. I'm the cardiologist. I'll look at Joel's heart, but I'm not going to worry about whether his mental health is okay. Sorry, I don't know why I said that. I just said yes. But you know what I mean? And you're just like, I'm a complete human being, and so I think that's kind of the what we're trying to get at. And so the capacity question, I'll maybe let others see if it stimulated some thoughts, but I do feel like we're trying to say, okay, if we keep using the medical practitioner, terminology, we want people to be able to say, okay, like when you come in for a consult and you present with a headache, we're gonna ask you about, the environment that you live in, whether you're stressed out, as well as just looking and taking your pulse and trying to maybe refer you on. So I think that has been lacking when people, go and do the hand pump installation that breaks down, a couple years later. But anyway, sorry, I'm rambling now, but it's a good point. And so, any more comments? Go ahead, Louis.
Thanks. Although I am wondering if there are any comments online also. If this is a hybrid session, but just a quick thought that I think we're moving in the right direction, and it's really good to hear this, and found the comments to be helpful. I do wonder if we can come up with indicators that grab people's attention. I'm thinking of things like the shit flow diagram, that is a very good way. It's very hard to have if you're the mayor of a city and you see the shit flow diagram and you realize that only 15% of the waste in the city is being treated safely, that is a really good way to start a discussion. And if there's some sort of equivalent that we can, some sort of indicator equivalent that we can come up with here that would make it stark and easier to have a discussion, because I still feel, and maybe this is a little reflected by all the diagrams up here, if you ask 5 people what a wash system is, you'll get 7 responses. So we little more clarity on this and make it as salient as possible to political leaders. That would be very helpful.
Okay, again, yeah.
There is a very nice study that was done. Again, it was a study, a one-time study in Benin, where I also worked, which led to the report Le risque des effets éphémères, the risk of shitty result. Can you say that? Or flimsy result, I should say. And the most convincing sort of shit flow diagram type of indicator that was in there was the quality of water that people were drinking. Because they found that the people having public standpipes were having the same level of fecal contamination as the people drinking water from the river. That was because the people from the river, some of them had chlorine, so it was only 60% that was infected with fecal material. And the people drinking water from the standpipe were reinfecting their clean source, and they came up to the same level. So that was an extremely convincing element in then mobilizing a lot of money for hygiene, because that's where the issue was. There was open defecation all over the place. And it led to a major investment in CLTS and whatever you can think about that. But it led to a lot of action as a result of that. So that was, for me, when you said that, thank you for using that example, but that was really a shit flow type of indicator that was really really working.
Wow.
Oh, hi. Thanks. First off, yes, good stuff. We should do it. Yes. I mean, sure, everything's got its challenges, but we shouldn't necessarily get fixated on the challenges and ignore the positive benefits of these types of things. My question is a bit related to the thought given to the people on the ground that is actually going to have to do a lot of this work. I like the idea of having only a few indicators that are very powerful and so on, but I think, again, you have to be careful not to oversimplify things, because then they become unactionable, or they can be overlooked or ignored, or you get caught up in just debating them rather than doing anything with them. And so we've actually spent a lot of time really grappling with how do you measure in the projects we've been doing, how do you measure change at a facility level? So like what is a wash system? What does that entail? And then how do you measure progress on that sort of thing? And going back to this question of the people that actually collect the data. So that was one problem, and I think we've discussed that, but the people that are actually writing down the numbers or counting up the instances of this, or whether this training happened, or whether this activity or this repair or whatever, that is not something that they will resonate with most of them. They're very busy people. They are very one of the challenges in any development field is to be careful not to just add more work to people. So I'm just kind of curious but nonetheless, these people are so integral. We found that these people, some data wasn't getting collected. If it was collected, only sort of half the indicators were being marked down. So how do we sort of pay attention to those people, and maybe build their capacity, be conscious of the role that they play in measuring this stuff, so that what gets up to the decision makers is accurate, is useful, and can be actioned on. Thanks.
role as a moderator, and I should have asked you to introduce yourself.
My name's Sean Irwin. I'm a professor at a university in Canada, Royal Roads University.
Okay.
Thanks.
I think there was another comment from this side.
Thank you. Emmeline Berezia from Agvo. Actually, I want to build on your argument and ask ourselves to think about the difference also between the wash sector and the health sector. I think we should really go towards what has achieved the health sector, but also be conscious about the difference we have. And one of them, I think, is on the health sector. They are much more advanced on routine monitoring. And the example of COVID shows that how they can manage timely data very quickly. That I think we are absolutely not there yet in the wash sector. And the second, so on the collection of data and on the use of data, it was also mentioned, wash is still a very political political subject. And I don't think that's the same level with health. So with data in health, there is action. Is there action?
Because Fiona, tell me if I'm wrong here, but that World Health Report from, was it the year 2000? Essentially, as you're saying, Patrick, benchmarked countries, if I'm right, on the performance of their health system. And guess who almost lost their job? Everyone involved in that report, because it really ticked off a lot of countries. So yes, I'm just trying to say that I think it must have been contentious for them, and that's something that we're going to have to play with now, because I think when you show a policymaker, where there's weaknesses within their country, I think that's one thing, and then you compare across countries, and that's another tool. But we're anyway. But sorry, I didn't mean to. I just was triggered when Fiona put that up, because I'm like, that really, really caused some problems. Okay, sorry. Maybe what I can do now is just, I'm sure there may be some reactions from you to the audience, so I'm just going to let anyone who wants to speak grab the microphone, which I'm going to leave on the center table.
You have to fight?
No, but sorry, I should do this. Yeah, Kevin, you're...
Let me have a go at... Sorry, yeah, and I didn't get everyone's name, so just the two I'll have a look at is probably the capacity development question. I think it's a very important one. I think with regards to, and I was saying this in another conversation, that in the developing world we have a set of migratory things to consider. The one being migration from rural to urban, of course, sometimes now the other way around since COVID, so people from urban to kind of semi-urban, and then of course migration out of the country altogether. Underneath all of that is people leaving the wash community sector because it's not attractive. Pay isn't great, lots of pressure, it's political, etc. So when you spend a lot of energy, and there's a lot of capacity development in this particular sector, you're constantly resetting. And the analogy I gave this morning is like starting up your computer, you get past the Windows screen, and you hit Control Alt and Delete. You wait for it to load up again, and you keep doing it. So we are in a game of capacity development. I think we need to get into a game of retention and into a game of evolution. And this kind of excites me. I don't know why, maybe I'm too geeky. It excites me because there's evolution, which suggests that someone left their computer long enough to open Windows or Excel. I think the other one I'd like to look at is the health sector is different to the wash sector. I think that has been the top of my mind, because I also think if there was a global wash-based pandemic, could we respond the way we did with COVID? I don't think we could, but I also think that sometimes necessity is the mother of invention, and we can say don't let a good crisis go to waste, as some of us have said in the wash community, and we are hitting that crisis point. And that crisis point forces sometimes politics to be put aside in the benefit of the greater good. So I think that while they are different, there are enough parallels we can learn from. And I think the key point is, again, with any indicator, and it's a resounding yes, does it actually teach us something? I mean, if you reflect on something as simple as CPI-X, everyone knows what CPI or CPI-X is, and they know what inflation is. You don't know anything about what's behind it. But if it goes up, everybody reacts. You have to, because it's an economic indicator. Now, we don't have that sort of level of indicator power, right? Maybe let's focus on that. And I think you have to build the indicator first before you actually build the power around it. Thanks.
Yeah, a couple of very quick reactions. Maybe first on you, Kevin, on talking about with the wash. Because and immediately cholera comes to mind. We have to think what happened to the wash systems during the pandemic when there weren't people out there maintaining them and there wasn't money coming in to pay for that. So I think we actually have a lot of thinking to do still on the pandemic, but we are a very complicated sector. We cross-cut so many different ministries that at least that Minister of Health has control, or thinks he or she has control over that system right down the line. I wanted to say 3 things super quickly. Yes, on principles, we have come a long way. We shouldn't lose that momentum. We're close. We do need to do another kind of iteration, but we're close. And we're close. What are we close to? We're close to a small set of indicators that Joel put his finger on, that whether we like it or not, that's going to inform good or bad policy. So we have to do it. There's no backing out of that. And the last point, we have to do it and be prepared for the long haul, because those indicators, they're not going to, that type of input and effort. And we all know systems, it's so complicated to make an impact, and we're not going to see that impact in the next JMP report. We might see it in 2 or 3 reports down the line, but we have to stick at it. We have to be there for the long haul. Thank you.
Thank you. Just when you were trying to check the heart and then look at, the whole person, it just triggered a thought that usually comes across in various meetings and engagements that I'm part of. When we go to talk to decision makers and influencers and politicians and, policy makers, we talk about water sanitation and hygiene, and they'll tell us, oh, there is something very important on nutrition happening. Are you aware of that? There is something on climate change now. It's always everybody's agenda. And, we get into education and health, and then we have to talk about WASH and see why it is a key enabler for so many development, issues and priorities of the government. So having said that, I feel as we start to rethink or reset or, reimagine a WASH system, our conversations should perhaps also look at the broader ecosystems in which the WASH systems exist, because while WaterAid's diagram is a bit complicated, I think one of the things I do like about it is trying to help us understand the political economy of the context that we are working in, and then locate how we can make, these advocacy or positions that help us prioritize the strengthening of water sanitation and hygiene systems so services are delivered for the long term. On just an example, because we were talking about learning from the health system in Nepal, I feel one of the key progress we see that the government has made is on hygiene behavior change in routine immunization programs and how it is monitored. Very simple. So in the health monitoring management information system, there is just one indicator on hygiene sessions that are conducted at the very local level in wards and villages. And that data is reported by female health community voluntary workers. Very simple, and that one indicator has become a very powerful way of helping the government to prioritize and invest in hygiene behavior change, which is reaching out to mothers and babies, 650,000 a year. So I feel those kinds of success stories do create the momentum to then make a case for WASH indicators that are simple and not complicated, but help us prioritize for people's health and well-being.
Thanks. I mean, first, I think I could almost just say what Aidan said, I think WASH is immensely complex, right? And I've spent most of my career, I've spent a big chunk of my career sort of talking about the complexity and the need to be context specific, and we have to respect. But, at a certain point, I think we began, and a lot of time writing about and describing the complexity of the WASH sector, water and sanitation and water resource management. At a certain point, you begin to, and irrigation. Hygiene. Absolutely. And you begin to realize, what? To the point it can become almost anthropological, it can become almost sociological, and that's great, but actually that's not helping people. And I think in the last 5 years, I've sort of gradually, at least my understanding of what my role is and what my organization's role is, to try and help simplify it. And one of the things you notice is that WASH sectors in countries that are providing very high levels of service, like the Netherlands, like Singapore, are actually a hell of a lot simpler, less complex than WASH systems in countries where there aren't, where every single NGO is developing its own mini wash system. Every donor is developing its own mini wash systems. You know, I remember in 2008 doing an inventorization of all the different service delivery models in Ghana. We mapped almost every small town in the country. I can't even remember how many there were, but believe me, there were a lot, because everyone's doing their own thing. There's hundreds and hundreds of flowers blooming. And to me, a big part of what this is about is giving us a language so that when I go and talk to a minister of water, or increasingly, as we're aiming to, the presidents, it's to have a simple message. And, you know, several of you said, when we go and talk to a minister and we say wash systems, it's not sexy, right? It's not sexy, I think, because we're still lacking this last. We've done lots of work on raising awareness, but we're lacking. What are the sort of 5 indicators? What are the 5 vital signs, going back to your analogy, Bruce, what are the 5 vital signs of a healthy wash system? So that we can go, Mr. Minister, look at your neighbour. They're green on all their vital signs. You're looking appalling on 2 and 3, but we'll plug you into, I don't know why, yeah, poor Joe. You're looking appalling on, and we can help you with that. And this is, you know, because I think that's what's lacking. We've got to get away, and I wear a t-shirt that says wash systems nerds sometimes. We can all get very nerdy, I think, in this room. It's part of it's the joy and the, and the downfall of our sector, but we've got to be less nerdy sometimes, and I think this is where the capacity building, this is where the explaining to people comes in, by simplifying, by sharing language, so that we all understand what we're talking about when we walk into the room and begin to talk about regulation, to talk about non-revenue water, to talk about engineers per person, to talk about total per capita investment, whatever it is that we decide those killer indicators are, and what the wash system is. And I think that's what, no, it's gone away, but that's what your diagram from the health sector is showing. Yeah.
So first I want to assure everyone my mental and physical health is fine. To the best of my knowledge. You may know something I don't know. Just a couple quick points. Look, on this notion that water is very political, I would argue respectfully that we're not political enough, okay? Because if we were political, we would be at the forefront of the discussion with the Minister of Finance and the executive, and we're not. And that's kind of why we're in the trouble we're in. And it's been that way, and I had earlier worked in the energy sector during the energy crisis, and boy, they got a lot of money, a lot of policy inputs, a lot of indicators, a lot of attention. Same thing during COVID. Very quickly, the sector mobilized. So in some ways, I don't think we're political enough. On the question that you're confused, that's good. That's you should be. And I think part of that's because it is complex, and I think Patrick sit on it. We are not. We talk about this related to WASH, but I have learned over the last 5 or 6 years that there is a water system, and the last mile, or WASH, is very small compared to the middle, irrigation, and then the bulk provision, and it's all connected. And boy, you really want to get confused? Start looking at the entire system and try to figure out what to do. And it's complex, and then we dig down. So we don't just look at the hydrology, we look at the weather, we look at the financing, and you will get very confused. But our job is to pull it up. And that's not to mean you shouldn't have 100 indicators, Lewis. You can. I have no problem with that. But eventually, no, I'm not saying we create 100 indicators, but there are data points, and we need that information, because if we have better information, we'll make better policy and make better financial decisions. It is, to pick up on Lewis's point, our job to distill those facts and figures and make sure we have a narrative that can change and go back to the political environment. So with a little luck, I've touched on all of your points to demonstrate that I do have my mental health.
Yes. Sorry. I don't know if Joel's going to ever come back to a panel that we invite him for, but I think we're, oh yeah.
Just one last point, sorry. I should have said it earlier. I think it sparked while thinking about CPI. one of the challenges is the frequency of how we release the data as well. It's really important, because if we keep doing things every second year or every third year, then an indicator gets less powerful. What makes the EPI work is it's integrated into every statistics office in a country. People accept the methodology. It's truly global, and you get it on a monthly basis. And I think we do need something, like you say, let's get more political, but more frequent as well. Thanks.
Yeah, I mean, I think if these things have to be used consistently by everyone, and I think your point about local, kind of specificity, Patrick touched on it as well. Of course, there's going to be more indicators used, but we have to select a few, and hopefully the next discussion we have, there'll be, will elicit maybe hopefully less confusion. I hope we can walk away from this thinking that this is like something worth investing in. I hope that when people think about this, they are thinking certainly at global level. When all this is aggregated up, we can think of 10 or 15 indicators, maybe more, I don't know, that tell a story. I mean, a cholera outbreak could be, an epidemic from WASH is a WASH systems issue. Anyway, so thank you for all the insights. I want to thank yourselves that was kind of spontaneous audience interaction there, and also the panel for standing the whole time, demonstrating all of our good health, physical health. And thanks to the presenters, and let's try to work together on this, because I think it's worth all of us working together on, so that we can talk about this issue with consistency, predictability, and clarity as much as possible. So have a great afternoon.